now. So, stroking. This is my patient. This happens to be my daughter. Can you guys see me? No? Let's see.
Yeah, I can see you.
All right. Thank you for letting me know. Okay, so I'm trying to get this to the point where you guys can see the whole thing here. Okay, there we go. Okay, the room is kind of small. So you'll see that I've got Casey laying here. This is a massage table, as comfortable as possible. I've got some pillows under her legs here. If she was on her stomach, I would have a pillow under her abdominal area and probably under her tibias. Okay, you really want your patient to be comfortable. I do have a faceplate up here since she's on her back. I've got a pillow under her head. And then I've got her completely draped here. Okay, so I'm going to start with stroking on the leg. Okay, and then I'm going to go right into petrissage. We will then come back to contras and precautions. You'll see I'm going to ask, do I have your consent to perform these techniques on you?
Yes.
Okay. Do you have any history of congestive heart failure, osteoporosis, any skin disorders that I should know about, or do you have any allergies to lotions or anything like that?
No.
Okay, so we're going to proceed. This is going to require me to do some hands-on techniques with you. I'm going to keep in constant communication with you. You let me know if anything is bothering you or if there's any pain, okay? I'm going to start out with a very mild stroke. I'm hand sanitizing, okay? Clean hands. My nails are cut short-ish. And for today, I'm just using just a regular Lubriderm. It has no perfumes or anything in it. In the clinic, you guys will have actual massage creams and lotions, and I do have also massage oil. But for today, this is just Lubriderm. So what I'm going to do, because I'm going to go into an effleurage stroke here as well, I'm going to go ahead and elevate her one limb here, okay? And you guys, when you elevate, what you should do is make sure that the limb is supported all the way through. You can put this leg down, okay? And you'll see that the area that I am going to be working on should be above the heart, okay? It doesn't do you any good if the bottom of the foot's hanging down or if this is not above the heart, okay? So let's just say that she's got an issue, maybe she had a knee replacement, something like that, okay? I'm also then going to come and make sure that she's completely covered here, make sure that the only thing that is exposed, and you'll see I do this little tuck here, okay? That way I don't get lotion and stuff on her clothing, okay? So what I'm going to do, and I'm going to take her sock off. Do you mind if I take your sock off?
No.
Okay, here, hold that. Okay, so I'm going to start with just stroking. I'm putting my lotion on here. I'm going to warm it up in my hands, and what I'm going to do is I'm going to keep my lotion close to me in case I need to add any more lotion. Some places have the luxury of lotion warmers. This is my office. I don't have a lotion warmer. And then I will also warn the patient that my hands might be a little cold. And I'm going to start stroking, and I'm very superficial here, and you'll see I can go in any direction. I can go up, down. Stroking doesn't matter because I'm superficial. Now, if I was digging a little deeper, I would want to make sure that I'm going towards the heart. But this is just for me to get the lotion on her body, okay, for her to get used to my hands, for me to kind of feel her skin integrity. By that, I mean, is her skin thick? Do I feel pitting edema? Can I really tell anything about what's going on? If she has scarring, I may notice that the tissue doesn't move back and forth. So this is my stroking technique, okay? Once again, just to establish some sort of a rapport for the patient, okay? Nice and gentle. Once again, I can go across, but you really want to get as much of that limb as you can, okay? Once I stroke here, I may go ahead and you'll see I'm getting more lotion. I'm going to put it on my hand first, and then I can stroke this area, okay? I'm preparing the tissue, letting her know that I have a good quality touch, intentions, building that rapport, letting her know kind of what part of her body I'm going to be working on, okay? So this can be for acute or chronic pain, acute or chronic muscle spasm. As I'm doing this, she's getting some superficial circulation happening, a little dilatation of those vessels. She's relaxing, I hope. And I'm going to be communicating. How does that feel? Feel okay?
Yes.
Okay. Any pain?
No.
Okay. You let me know if it increases your pain or discomfort at all, okay? Okay, so now what I'm going to do is I'm going to go into something called effleurage, okay? Effleurage is a technique that I use my hands in general to move fluids, okay? This is actually skimming. So what I'm gonna do now is I don't feel like I need any more lotion here. I'm gonna make sure she's elevated because remember with effleurage, we are moving fluids in the lymphatic system, okay? We are going to be trying to get those interstitial waste products towards the heart. So now I'm going to take my hands and I can either use one hand like such, or I can, if I have a person with a bigger leg, I can use two hands, okay? I am doing the snowplow squeegee technique here. You'll see that I'm moving about 7 inches per second, and you'll see that I pause at her knee because I know that there's a shed back here for the lymphatic waste, okay? So you guys are gonna have to look up your lymphatic charts and see where the sheds are, because as I'm pushing the fluids, I wanna make sure that it goes where I want it to go. So I'm gonna pause and then come back. One hand at a time. Remember I told you yesterday you shouldn't lift both hands up off your patient, okay? I'm gonna probably do this for a minute or two in this area. Okay, pause, okay. One hand, plow, plow, snow plow or squeegee basically, okay? And actually, if I had planned this better, I'd probably have her leg even a little higher than this, okay? So probably another pillow, all right? Here we go, okay. Push, 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 push. Think about you're pushing water to the drain or you're pushing snow to the side of the driveway and you want to wait for it to pack or go down the drain, okay? 7 inches per second. I'm fairly deep. I'm taking up the space between the dermis and the underlying muscular tissue and joints or skeletal system, okay? So you're pretty deep with this, okay? Doing okay up there? Okay, so I've got the fluid here. Now I don't want to leave it there, so probably I'm going to come here and I'm going to start the same thing and I'm going to go up, and there are inguinal nodes as well, okay? So I can use one hand, come up, 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 pause, other hand starts, okay? Coming up towards the inguinal nodes, pause, other hand, okay? And you'll see I'm doing some deformation of that tissue there a little bit, right? I'm getting a nice deep, easy flow. And you'll see I've always got one hand on my patient at a time. When this one's up here pausing, the other one's coming on, or I start with both, okay? And I pause, and then in kind of a circular stroking, I can come back. So 3 to 5 minutes, or until I feel as though I've gotten what I wanted to accomplish with that, okay? So now let's say that she has some scar tissue and some joint adhesions and maybe some quad muscle spasm. Now I'm gonna come in and I'm gonna go on the other side so you guys can see me better. I'm gonna do something called petrissage, okay? Petrissage has multiple techniques. So I've primed the pump here with the stroking. I've gotten rid of some of the edema, okay? I'm gonna come in and I feel, oh wow, this quad is really tight. You feel that? Your quad is really tight. Is that painful?
Yeah.
Yeah, a little bit? Okay. Can you rate your pain between 0 and 10? What would you say your pain is in your knee?
Say 3.
3. Okay. She's got a 3 out of 10 pain here, okay? What I'm going to do now is that kneading. I'm going to come in with my palm and I'm going to start kneading. Like I have a big blob of pizza dough here, okay? I'm trying to get the air out of the pizza dough. And right now I'm really trying to get down into those muscular fibers and into that tissue, the connective tissue, and break it up. So you'll see me, that's palmar kneading, okay? It's kind of like lumbricals, okay? Remember we talked about lumbricals in neuro. I'm really getting in there and I'm squeezing in a circular motion and then I'm coming out. So squeeze, relax. Squeeze, is that okay? Relax. Squeeze, she's gonna volunteer to be our demo for the rest of the term. Trust me on this, okay? Squeeze, relax. Then I go to the different part of the muscle. So now remember guys, you should know which direction your muscle fibers go in. You should know what's under your hands, because if you feel something that doesn't belong there, you're going to want to take a mental note. Remember that intelligent touch so that you can document it. So as I'm doing this, come in the IT band, okay? I'm really palmar kneading. There's also a technique called picking up where I can pick up. So I'm grabbing with 2 hands and literally lifting the muscle up to the sky. You can do this on a calf muscle. You can do it on the bicep, tricep. Picking it up, and letting it just kind of roll through my fingers. Or there's something called ringing, and you'll see now my hands are going back and forth in opposite directions. So if I feel a lot of scar tissue I want to break up, I can do this, okay? Back and forth. This is ringing, okay? Back and forth. My hands are never leaving her tissue, and I'm going up and down the muscle. So I'm really getting into those quads, a little bit into the IT band on the side there, all the while taking note in my mind of what I'm feeling. So what if she had some tenderness around the patella, or I wanted to work that lateral retinaculum? We could do something called thumb pad kneading or finger pad kneading. These are both forms of petrissage as well. So I can come in and do these little semicircles here with my thumb. Let me show you on this side here, okay? Little semicircles with my thumb. Maybe trying to get to that lateral retinaculum, okay? Or maybe I want to come down around the patellar tendon, so I do this little tripod with my fingers here and just do little tiny circular kneading with my fingers, okay? Those are the big 5 methods of petrissage. So the first one being palmar kneading, okay? The second one being picking up, and you can do this on any part of the body, as long as there's some tissue, not just bone. Ringing, okay? Thumb pad kneading, or finger pad kneading, okay? Those are the big ones, okay? So think about if I just broke up all this stuff in the deep muscle, I'm probably gonna come back in and do a little more effleurage, try to get some of the waste out of there, okay? So think about your sequencing as well, okay? Maybe I would do that for a couple minutes in that area where I'm trying to move things around, okay? And then I'm going to finish off with my stroking, okay? Nice, easy stroking, okay? And I know that this is a leg. You guys will get an opportunity to do some of this on the back, and I'll do some demos of some other techniques on the back. There's something called skin rolling. There's something called palmar kneading, and we'll do those later. But these are the basic 5 petrissage strokes, and then the stroking technique, okay? I'm gonna finish up. I'm going to reassess if I did girth measurements, if I did a range of motion measurement, I would retest, okay? I'm going to ask my patient, what's your pain now? What do you mean it's a 1 out of 10? Awesome, okay? I'm going to document that, okay? And then what I'm going to do is probably follow up with maybe a rectus femoris stretch, or maybe some hamstring strengthening, or maybe just range of motion, maybe heel slides, okay? So I'm going to follow it up with something that is an adjunct to what I've just done. Remember, manual therapy doesn't just stand alone, okay? So thank you very much, Casey. I'm going to stop my video on my phone here.